All right, here we are. This is part 2 of the respiratory or pulmonary system. We are all the way down to section 5.5, treatments. Okay, so treatments. You have your notes out. You have your notes out like this. We'll do 5.5 treatments. Most lung treatments are about making sure that oxygen can come or can continue to get into the body. If a lung is full of fluid, then they will try to drain it. So what illness was it we talked about yesterday that has fluid in the lungs? Yeah, pneumonia. So there might be fluid in the lungs, which obviously air is tough to get into the blood system if there's water in the way, right? Air doesn't go through water very well. For infections, antibiotics are given. For difficulty breathing, oxygen can be given as well. So sometimes you see people with the clear tube that's kind of connected to their nose. They have the little prongs that go up the nose there, and some of them carry an oxygen tank and that kind of thing. So if they're having trouble breathing or their body doesn't accept the oxygen very well, they need a higher dose of oxygen than it's in the air. And sometimes they'll have a pure form of oxygen that they actually breathe in. So there's a limited amount of oxygen in the air. If there is too much oxygen in the air, do you know what might happen if there is too much? You can cut these, the first switch, just the first one. Yeah, that's good. So what would happen if there was too much oxygen in the air? Anybody know?
Blow up.
Okay, blow up. What blow up?
Spark will just blow up the gas.
Okay, so remember the key component of a burning fire is the fuel of oxygen. So yeah, if there was too much oxygen in the air, then any kind of spark or things would just like light on fire. They would just spontaneously light on fire. So there has to be a certain number of nitrogen and other gases in the air to prevent that from happening. So yeah. Yeah, there's other things in the air that other parts of our life require. That's correct. Yep. Ready to go? Okay. Next page here. CPAP, a CPAP. So some of you may know this or have seen this before. Maybe you have a relative that uses one of these. A CPAP, that stands for continuous positive airway pressure. Continuous positive airway pressure. Where are we here? Okay. Yeah, CPAP is when oxygen is continually flowing through the nasal canal into the nose. This is useful if a patient is having difficulty getting enough oxygen with each breath. And a lot of times people with sleep apnea, do you know what sleep apnea is? Sleep apnea is when you're sleeping, the body, you actually stop breathing for long periods of time. And it's a lot of times is because your body's not getting enough oxygen, so it slows right down, and the airways start to, not collapse, but they start to get narrower, and there's just not enough oxygen coming in, and then all of a sudden you kind of almost stop breathing, and then it's like, and so people that are like, when they're sleeping, if they're not breathing, it sounds like they're not breathing, and all of a sudden there's this big, big snort, and they wake themselves up sometimes, and so a lot of times these people that suffer from that need a CPAP. And so just you plug it into the wall, it's kind of a machine that kind of goes like a fan or something that's on beside you. But strap it on and sleep it, and these people get a lot of comfort there, and they get the oxygen they need so their body is able to sleep well.
That's the mess. The pilot,
Sorry?
the jet pilots, they also wear something.
Yeah, the pilots. This sort of it seals the mouth and nose, and so that whatever's coming through the tube goes right into your body. Okay, all right. So the BiPAP is a little bit different. It's a bilevel positive airway pressure. Bilevel, bi means two, is when there is a higher burst of air pressure for the inhale and a lower pressure to allow for the exhale. So that makes sense. If you're trying to breathe air in, a higher pressure helping the air to go in, and then a lower pressure out. Now, it's a little more complicated, obviously. This is for patients having difficulty exhaling. And this isn't quite as common as a CPAP, for sure. BiPAP, okay? Intubation and ventilators. Okay, let's talk about intubation and ventilators. So intubation and ventilators This is when a breathing tube is placed down the trachea to keep the airway open and to allow for oxygen to be administered closer to the lungs. A ventilator will blow oxygen into the lungs, then also suck air back out if the patient is not able to breathe under their own strength. So a lot of times this happens in hospitals when patients are in a coma or they're unconscious for long periods of time. The intubator, my son was born premature and he was in NICU for a while and he was intubated, so they had to basically the machines had to kind of breathe for him. Being born slightly premature, his lungs were not quite fully functional, and so they had to do an operation actually. So he was breathing so hard in his little body. He was only 4 pounds when he was born, and he was breathing so hard he ripped a hole in his lungs because his lungs weren't getting the oxygen that his body needed. So anyway, so they had a tube going in from the side through, and he had a whole bunch of wires and tubes going into him, and it was quite dramatic actually, being our first child, and we're in NICU for weeks with him. But anyway, so he was intubated, and so the machine was kind of feeding oxygen to him while he was recovering, and they would have to give him like medication that they would basically shove down his throat into his lungs. They would put this like thick mucousy medication to get into his lungs. They would like rotate him around like this and stuff, and like to make sure it coats all of his lungs and stuff. And he's like this big. Anyways, yeah. So a ventilator and an intubation. Intubation is usually a little more intense, I think, than a ventilator. I think a ventilator can be attached to the face there. And intubation is more of a direct method. This tube here. And I can't remember. I think they went through his mouth. I know that when you get your throat inspected, if you ever have to get that done, or if they have to like examine your bronchioles or anything like that, like with a camera or anything like that, they always go up your nose. So they don't go down your mouth because the gag reflex. Actually, I had that happen to me once when I first started teaching. I was in a band. I was singing a lot. I just started teaching. I wasn't taking good care of my voice, and I was using it heavily. I lost my voice for 4 months in my like second year teaching or whatever that was. That was really, really bad. I could only whisper, and so I thought there was some major damage. So I had to get like a scope. Like I went to a doctor, went to a specialist. They stuck this camera down there and said, yeah, we have to take a look at your vocal cords and everything. And so anyway, so this thing went up my nose. I'm like, oh, here we go. Oh, of course you feel it. Yeah, I'm like totally like awake. But you remember the COVID test? Remember that stucking it up your brain? So it's like it's basically like that. But I think they might have numbed me a little bit, like squirted some stuff up there to make it a little more numb, so I couldn't feel as much. But yeah, this thing basically went up my nose, like did a couple trips into my brain. It felt like, and then it went down through the back of my throat, and they were like showing me the pictures of my vocal cords and stuff, and it was like, okay, done. Let's get this out of here. So yeah, but they usually go up your nose so that you don't like puke, like gag and puke. But because you don't like, it's like weird. It's this weird feeling, but you're not gagging at all. So you guys remember that stupid swab thing with the COVID thing, right? It was like this long. Did you guys ever do that? Just like my brain. It didn't actually touch your brain though. Okay, just so you know. All right, moving on.
That would be terrible.
Oh, to surgeries. Okay, much better. Okay, surgeries. Oh, there's not much here. Sometimes cancerous tumors will need to be removed. If you have lung cancer or if someone has tumors, which is uncontrollable cancerous growth, right, in their lungs, will have to be removed. Sometimes lungs get so diseased and so terrible they can't be fixed or repaired, and a lung transplant is possible. There's a lot of organs in your body that can be transplanted from another living being. Mostly it's humans. I guess there's some things that can be taken from animals too, but mostly it's other compatible humans.
The brain cannot be
The brain, yeah, I don't think it'd be brain transplant. No, I think that would be a little tougher too. Yeah, there's lots going on there. Okay, careers. Let's end up with careers here. So the careers for this system largely have to do with the lungs, obviously, respiratory. So there is a respiratory therapist. Okay, we're almost done here, boys. Stay focused. Respiratory therapist, respiratory therapy technician. There are also specialists like cardiothoracic surgeon, perfusionists, internists. I think we talked about these before, like internal organs and stuff. Ear, nose, throat specialist. That is an otolaryngologist. Could be pronounced a little differently than I just pronounced that. Maybe? Otolaryngologist. So ear, nose, throat specialist. We just call them ear, nose, throat specialists. That's what they call them. Nobody uses this term that I know of. But anyways, so that guy that stuck the camera up my nose there, that was the ear, nose, throat specialist. So yeah, so if you want a very fulfilling job, here you go. Take a pick. Right there. Good. Okay. Just a note, technicians. Okay, technicians usually work alongside doctors or therapists. The therapists or the doctors usually have the schooling, a little bit more schooling, and they are the ones that kind of prescribe what to do. The technologists or the technicians a lot of times are the ones that actually do the thing that the therapists or the doctors say that they should do. So the making the decisions would be the doctors, the technicians. So if you're doing ultrasound, you're not the doctor that's prescribing the ultrasound or reading the ultrasound data. If you're an ultrasound technician, you're the one actually doing the ultrasound and taking the pictures, and so that's a little bit different. So a technician, a technologist is often one that's actually doing the stuff that's been prescribed. Yeah, go ahead.
Sometimes the doctor has to do it themselves, depending on.
Well, of course, the doctors do some of this stuff themselves, yeah. But like x-rays and stuff, the doctors don't take the x-rays, right? The doctors don't take the blood, the doctors don't do the ultrasounds, it's technologists.
My dad does ultrasounds because they don't have an ultrasound technician
Right,
in the places where he works. So
Sure.
he just does them.
I'm sure, yeah, doctors do it sometimes too, but largely the technicians are the ones that actually do those kind of things, yeah. Yeah,
The blanks are a bit weird. Yeah, there's extra blanks.
the blanks are a bit weird. Well, thanks a lot.
Sorry.
Yeah.
There's like extra blanks or words that need to go in there or.
Which part specifically?
The last one.
For careers? Okay, well, make sure you have everything that's on here. So respiratory therapists have to do with the lungs, respiratory therapist. Okay, so respiratory therapist you guys have on there.
Yeah, it's.
So,
The second last is blank.
the second last blank?
Yeah, on our sheet.
Surgeon, perfusionist. Okay, yeah, it looks like there's an extra blank there, just out of order. Yeah. No, just make sure you have everything that's on here. I think there might be 2 extra blanks that I could maybe see. Yeah. Yeah, I'll fix that. Don't worry about that. Just make sure you have everything that's up here. Okay? All right, any questions? All right, that was a little bit shorter lesson there. That's part 2.